Okay, we got to talk Ozempic again, because a new report claims Ozempic may reduce alcohol cravings. The study finds 40% of participants who struggled with alcohol abuse and took the weight loss drug reported 0 days of heavy drinking. This is compared to 20% of participants who took a placebo. Joining us to talk about this and our other health headlines today, he is Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you.
Thank you.
Ozempic strikes again, not just food cravings that are going away.
Right, and it's sort of difficult to figure out where it's going to go from here because all of these good things keep happening with these GLP-1 agonist drugs. But in this one, it was a small trial, only 48 participants, and it was a very limited time period, only 9 weeks. But what the researchers found was that there was significantly less alcohol consumption and alcohol cravings in the participants who received the Ozempic drug versus those who received the placebo. More research has to be done, of course, but the 40% reduction is a huge win for people who battle with alcohol use disorder.
I'm so fascinated by these drugs and all the headlines that have been coming out about them, but do we know exactly why the cravings seem to be going away, now food and now alcohol, with these types of drugs that they haven't or weren't able to figure out before this?
Well, there might be a place in the brain that's considered sort of the reward center for your body. And the GLP-1 agonist may be working there to alter the way you perceive the rewards. And so it might be that you don't feel that same gratification that you get from something like alcohol or smoking, and it decreases your craving for it. It could also be that it's up-ramping the reward center, and you feel really good without having alcohol or smoking or something else addictive. And so by manipulating the brain at this level, it's likely that it's causing a really beneficial effect.
It's fascinating. And I think my reward center was going off last night when I was on the couch eating junk food. For the first time since the start of the pandemic, flu deaths now outnumber COVID deaths. What's your takeaway from that report?
Right. According to the CDC, the flu deaths in the last week of January did exceed COVID deaths. And so I think this is really a sign that COVID, which 5 years ago at the beginning of the pandemic, really overtook every other virus in terms of causing deaths in the United States, is not the same virus that it once was. And people have much better immunity against it. At the same rate, I think that part of this is because people have been hesitant to get the flu shot this year, and the uptake has been quite low, especially in children, where the uptake is now below 45%.
Yeah, and you were saying, I mean, the numbers were bad last year, even lower this year. Is it too late to get the flu shot?
Never too late. The flu shot is readily available at the pharmacy or hospital next to you. And if you can, go get that flu shot. It will protect you.
And it's still spreading, because every time my daughter sniffles, I'm like, oh, I hope this is not the flu. So, Dr. Bill Hartman, appreciate your time. Really good stuff. Very interesting reports today.
Thank you.